This is a case of a giant meningioma on the left sphenoid ridge that is growing from the lateral wall of the cavernous sinus. Patient is placed in a supine position with a slight rotation of his head. Following a frontotemporal skin incision, a standard trional craniotomy is performed. The dura mater has been opened and the retractors are placed to show the superficial portions of the tumor. Initially, a window is performed on the surface of the tumor by using bipolar coagulation. Then, a biopsy is taken to make the transoperative histopathologic diagnosis. Tumor resection is continued with an internal decompression. This debulking process is very important because it will allow a gentle manipulation of the tumor margins. When debulking is finished, now it's relatively easy to show the tumor margins. Here, the inferior border of the tumor is shown. Now the superior surface of the tumor is mobilized, and then the posterior limits of the tumor. When this process is finished, it's very easy to pull the tumor towards the center. The next step is the coagulation and detachment of the dural implant. When this is finished, now the tumor is taken out of the surgical field. Now it's time for the resection of the last but most critical portions of the tumor, the small pieces that are close to the carotid artery. This is the supraclinoid internal carotid artery. All those pieces of tumor that are close to this artery have to be taken out very carefully. Preservation of the arachnoid plane is very important in order to avoid damaging the arterial wall. Finally, the last step of the resection is the removal of the dural implant. In this particular case, the implant was located on the lateral wall of the cavernous sinus. A plane has to be created between the dural implant and this lateral wall of the cavernous sinus. A sharp instrument is very useful for that purpose, being very careful not to damage the dural wall. In some areas, it is not very easy to create this plane with sharp dissection. Scissors are then very useful. Surgeon has to make precise cuts, trying to avoid leaving small pieces of tumor on the surgical bed. When the dural implant is completely out, it is time for the final coagulation of the dura mater in this area. All bleeding points have to be carefully identified and controlled because they are the most frequent sources of postoperative hematomas. Then, final hemostasis begins, followed by the dural closure.